Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Desipramine. Its brand name is Norpramin. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Desipramine works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Desipramine. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects. So how does Desipramine work? Well, Desipramine is a tricyclic antidepressant. The exact mechanism of action is unknown, but it is thought to include the blocking of the reuptake of norepinephrine and serotonin. In terms of indications or reasons we would prescribe this medication to a patient, we would usually see this medication used to treat depression. There are also two off-label indications, which would be diabetic neuropathy and postherpetic neuralgia. With respect to contraindications or reasons we would not be able to prescribe Desipramine, we wouldn't give this medication to a patient who had a hypersensitivity to Desipramine or to any other component of the formulation. Medication is not to be used within 14 days of a monoamine oxidase inhibitor, and we also wouldn't give this medication to a patient in the acute recovery period following a heart attack. Now, what about dosing with Desipramine? So in the treatment of depression, we would typically see 100 to 200 milligrams per day orally in a single dose or as divided doses. The patient sometimes may start at a lower dose and slowly increase based on response. The maximum dose would be 300 milligrams per day, and occasionally this dose may need to be initiated at hospital. In the off-label indication of diabetic neuropathy, we may see 25 to 50 milligrams per day, orally given once daily or in 2 divided doses. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Desipramine, so I'll go over some of those here now. Some patients may experience constipation or xerostomia, also known as dry mouth. Dizziness and somnolence are possibilities. Some patients may experience blurred vision or fatigue. Now, some more rare but serious side effects would be suicidal thoughts, jaundice, or an abnormal electrocardiogram. That's all we're going to talk about today with Desipramine. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.